Hi, for this week's video reflection, I'll be talking about the reading materials and assigned learning from week 14. We'll start with question 1, which was what surprised you from the materials this week and what didn't surprise you? So, something that surprised me after doing the readings was some of the facts about schizophrenia. I was really surprised to know that the diagnosis made in men is in the ages of their early 20s, and women aren't diagnosed typically until late 20s, early 30s. I just found that to be surprising because it's such a serious diagnosis, and it seems like kind of later in life to find something out like that, that you could be suffering from a disease like schizophrenia. Something that didn't surprise me that much were some of the statistics that are surrounding substance abuse. Substance abuse has been in the news a lot in the past 5 to 10 years and has been a growing problem in our society. So one of the statistics that I read in our text was that in 2017, 70,237 deaths were related to substance abuse, and that 67% of those involved opioids. So as still staggering number that is, it just didn't surprise me, unfortunately. I wish it surprised me, but it did not surprise me that much. So moving on to question 2, 3 facts about mental disorders that I learned this week. One of which is some of the changes that happen in the brain of schizophrenic patients. Gray matter changes in the temporal lobes and enlarged third and lateral ventricles, and then the excessive dopamine secretion that occurs in these patients. Medications like Thorazine or chlorpromazine are actually used to interfere with the dopamine secretion. So I'm sure I learned that in nursing school, but it was interesting to learn it again this week. And then causes of depression, genetic factors that are involved with a diagnosis of clinical depression. I found it really interesting that if you have a family member that's diagnosed with clinical depression, you actually have 3 times more chance of having that diagnosis yourself. And then just depression is defined as a mood disorder that causes disorganized emotions, and it's caused by a decrease in activity of neurotransmitters like serotonin and norepinephrine. Panic disorders also involve abnormalities of neurotransmitters like norepinephrine, serotonin, and GABA, which is the gamma aminobutyric acid. That's always a mouthful for me, so from moving forward, I will just say GABA. And so again, just abnormal levels of those neurotransmitters can cause people to suffer from panic attacks and feel anxious and have physical reactions like heart palpitations, sweating, tachycardia, in circumstances that aren't typically unsafe or situations that wouldn't typically cause someone to feel anxious. So moving on to question 4, identify 3 things learned about substance abuse disorders. This was actually what I found to be most interesting this week was the role that alcohol plays on the brain and what happens to your brain when you drink alcohol. That GABA neurotransmitter that we were just talking about acts as an off switch and actually restricts brain activity. So when you introduce ethanol, when you're drinking ethanol, the effect that it has on your brain is that it binds to GABA receptors and makes the inhibitory signal even stronger. So it's really shutting down brain activity and kind of slowing everything down that's going on in your brain. And then in addition to that, ethanol can activate the release of serotonin and norepinephrine. So first you have the slowing of your brain, and then you have a release of the happy mood neurotransmitters. So that's why people will feel a little bit more carefree and relaxed because of the increase of levels of serotonin and norepinephrine. So what I found so interesting was that I've used the term self-medicate in the past, and I knew that what I meant when I was saying it, that people will self-medicate with alcohol or drugs sometimes to try to not feel anxious or not feel sad or not feel anything. And now it's really interesting to know exactly what's happening in the brain when they are self-medicating. People who may have barriers against them to get a diagnosis of an anxiety disorder or depression or even post-traumatic stress, whatever might be preventing them from going to the doctor and getting that diagnosis and getting some prescribed medication, they could be using alcohol and drugs to try to just shut their brain down from those anxious thoughts and depressed thoughts. Alcohol use disorder and its long-term health consequences. So I was aware, obviously, that alcohol causes a systemic effect on the rest of your body. It's not just what's going on in your brain, but the list is lengthy. So alcohol use disorder can cause dilated cardiomyopathy, inflammatory changes of your liver, pancreatitis. It can also lead to different cancer diagnoses like oral, throat, esophageal, breast, and liver cancers. And then also vitamin deficiencies. I've taken care of patients that have Wernicke syndrome before, which is a thiamine deficiency, and that can cause memory impairment. Substance use disorder and the general indicators that someone is suffering from substance abuse. What we might notice in these patients is changes in behavior, changes in appearance, changes in daily living patterns or work habits. And they also might become angry or defensive if you bring up their substance use. What I'm most excited about is that I am on the psychiatric mental health nurse practitioner track. So what we learned this week is really what my future entails. And I really, really enjoyed learning about what's going on in the brain. Like I said, with alcohol use and with all of these disorders, learning about the actual pathophysiology in the brain when you're dealing with these patients is really important to understand what medications I'm going to be prescribing and what kind of therapy I can also provide these patients to try to understand where they're coming from. And like I said, why they're using the alcohol, why they're using the substances, because I think very often it is because of an underlying diagnosis that hasn't been made. So I enjoyed this course actually way more than I thought I would. Things that I thought I knew because I've been a nurse for a long time. Really, the details that came behind all the different body systems was just really interesting, and it was a really great refresher for things that I've learned in the past and applying it to my day-to-day nursing practice. But this week, like I said, I was very excited about learning what's going on in the brain. So thank you very much. I have enjoyed this course and look forward to next week. Thanks.